Very good evening. I'm Dr. Maciej Danilewicz. I'm a consultant psychiatrist and cognitive behavioral psychotherapist. I'm the medical director and founder of NLM Clinic, and I'm a psychiatrist in a private practice. As mentioned in my previous videos, I would like to touch on various psychiatric disorders. And as I was asked by my viewers, I was asked to actually talk about personality disorders, and in particular in what is called cluster B personality disorders, which includes emotionally unstable personality disorder. I will be talking about emotionally unstable personality disorder. So, to start with, what is personality disorder? In psychiatry, we very often to describe various psychiatric conditions, we use diagnostic and statistical manual called DSM-5, which is published by the American Psychiatric Association. And in terms of personality disorder, this particular manual defines this as a condition which is characterized by an enduring pattern of inner experience and behavior that deviates significantly from cultural expectation, manifesting in at least two of the following areas: cognition, affectivity, interpersonal functioning, or impulse control. And this pattern is inflexible, pervasive across situations, causes significant distress or impairment, and is stable and long-lasting, with its onset traceable to adolescence or early adulthood. It is also required not to be better explained by another mental disorder, substance use, or a medical condition. So what that means actually is that personality disorder is a pattern of inner experience, a pattern of emotions, but not only emotions, and behaviors that are not culturally acceptable and are impacting on one's cognitive functioning, emotional functioning, interpersonal functioning, and the impulse control. And personality disorders are grouped into three clusters. So it's cluster A, B, and C, based on shared behavioral patterns. So cluster A is characterized by odd or eccentric behavior. Cluster B by dramatic, emotional, or erratic behavior, and cluster C by anxious or fearful behavior. So in terms of personality disorder, cluster A, which is defined as odd or eccentric, we have three subtypes of personality disorder, which is paranoid personality disorder, which is characterized by distrust and suspicion of others, often without justification. We've got schizoid personality disorder, which involves detachment from social relationship and a limited range of emotional expression. And we've got schizotypal personality disorder, which is marked by eccentric thinking, peculiar behavior, and discomfort in close relationships. In cluster B, which is described as dramatic, emotional, or erratic, we have antisocial personality disorder, which involves a disregard to others' rights, often manifested as manipulation, deceitfulness, and impulsivity. We've got borderline personality disorder, the one that I want to talk about today, which is characterized by instability in relationship, self-image, and emotion, along with impulsivity. We also have histrionic personality disorder, which involves excessive emotionality and attention-seeking behavior, and narcissistic personality disorder, which is marked by a grandiose sense of self-importance and need for admiration and the lack of empathy. And finally, we have cluster C, which is described as anxious and fearful, which includes avoidant personality disorder, which involves social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. Then we have dependent personality disorder, which is characterized by a pervasive need to be taken care of leading to submissive and clinging behavior. And finally, we have obsessive compulsive personality disorder, which involves preoccupation with orderliness, perfectionism, and control. But today I want to talk about emotionally unstable personality disorder. So, in terms of emotionally unstable personality disorder, it's also known as borderline personality disorder. And it is, in a nutshell, characterized by pervasive emotional instability, impulsivity, and disturbed interpersonal relationship. As we said, it's recognized by DSM-5 under cluster B of personality disorder, and ICD-11 classifies it as emotionally unstable personality disorder with borderline pattern. Just to explain, ICD-10 is an alternative classification which is published by World Health Organization, however, is significantly less descriptive. Interestingly, borderline personality disorder or emotionally unstable personality disorder affects about 1.6% of general population, with higher prevalence in clinical settings of those people will have some contact with the mental health services. It's predominantly diagnosed in females. Approximately 75% of people suffering from emotionally unstable personality disorder are actually females. And the question why it's much more prevalent in female, I think in general, female tend to be more emotional and express more emotions than men, which might be one of the theories. But also, females potentially are more vulnerable to exploitation and abuse, which is the underlying cause of personality disorder. There is actually no statistical or no scientific answer to the question why it's much more prevalent in a female population than male population. And what is the impact of the emotionally unstable personality disorder? So it is definitely associated with significant morbidity, including high risk of suicide, comorbid conditions, and impaired functioning. And if we're talking about comorbid conditions, very often it is related to drug and alcohol use as a form of self medication. And a lot of patients presenting in the drug and alcohol services actually do suffer from emotionally unstable personality disorder. So, what is the symptomatology as per DSM-5 diagnostic criteria? So, first of all, is emotional dysregulation. So it's very intense, rapid shifting of emotion, often triggered by interpersonal stresses. What I mean by that is that the person is experiencing extreme emotions, which can change from positive emotions very quickly to very negative emotions. So from feeling happy to feeling angry to feeling sad to feeling suicidal, which is usually linked to a trigger during a interpersonal interactions. So, person suffering from emotionally unstable personality disorder is quite likely to respond with extreme emotional reactions to certain statements or acts from another person. So, for example, a person who's suffering from EUPD might respond to the fact that they've texted someone and they didn't get the response straight away. That could be a potential trigger, which actually, looking at it, is something that they misinterpret as not being an interesting person or as being disregarded, which often is not the case. So this emotional roller coaster, I would call it a roller coaster, is often linked to certain certain behaviors caused by the emotion. So it could be linked with aggression. It could be linked with sort of decision to abandon this interpersonal relationship, decision to push someone away as not being sure if the person is truly interested in them. It's also characterized by impulsivity and instability. So very often people suffering from emotionally unstable personality disorder present with quite reckless behaviors. So that can be caused by the response to interpersonal relationships. They also suffer from unstable relationships, driven by fluctuating self-concept and poor affect control. So what we mean about it is that they go from extremes of being in a very intensive and close and promising relationship, and it involves not only intimate or close relationship with a partner, but also with other people, to suddenly changing into the pattern where they are pushing away the person. And it's almost like they respond to the triggers in relationships by pushing people away. So they terminate the relationship before the person can potentially harm them in any way. And this pattern is very pervasive. So talking to the person with emotionally unstable personality disorder that very often has a history of very intense but very short relationships or friendships where there is a persistent fear of being abandoned. But because of that fear, they terminate those relationships at the first occasion where they start doubting that the relationship is genuine. Also very characteristic for emotionally unstable personality disorder are self-destructive behaviors. So it's either self-harm or self-injurious behaviors and suicidality. It is a key diagnostic criterion and obviously clinical priority, as very often, very impulsively, people suffering from emotionally unstable personality disorder would make attempts on their life and would frequently engage in self-injurious behaviors in various forms. There are some other criteria which are outlined in DSM-5, which include disturbance of identity. It very often presents as the person not really knowing who they are and really struggling to describe during the clinical interview who they are. There is this persistent fear of being abandoned by others, and outside the extreme emotions, chronic feeling of emptiness. So the person suffering from borderline personality disorder is either experiencing extreme emotions or is not experiencing any emotions at all. So it's almost all or nothing. They can also present with intense anger, which is quite characteristic to the condition. When diagnosing emotionally unstable personality disorder from other disorders, we need to take into consideration quite a few. So first of all, it's very often mistaken with bipolar disorder. What is the difference? So bipolar disorder is characterized by episodic mood swings, which actually are longer in duration. And usually they can last days, weeks, months, where emotionally unstable personality disorder, those mood swings or extreme emotional responses can change within seconds. Also, we have a little bit of an issue here in terms of diagnosis. If someone is suffering what is called rapid cycling bipolar disorder, where the mood swings can, from feeling happy to feeling sad, can occur within minutes or hours, which is quite similar to how it looks in emotionally unstable personality disorder. However, what is important to elicit is that people with emotionally unstable personality disorder respond to environmental stimuli. What that means is if the person is suffering from emotionally unstable personality disorder, there will be a clear trigger, environmental trigger or interpersonal trigger to change of their emotional state. So it's a response from someone they know. It is something that someone said. It's the way someone behaved, which triggers the change of emotional responses. Where in bipolar affective disorder, even in a rapid cycling disorder, this is not the case. The mood swings are not related to any triggers. They occur naturally. And that's the main thing that needs to be elicited during the clinical interview. The second condition that has to be considered when diagnosing emotionally unstable personality disorder is post-traumatic stress disorder. I think the big difference between post-traumatic stress disorder and emotionally unstable personality disorder is that in post-traumatic stress disorder, one is experiencing or re-experiencing trauma. We call it flashbacks and nightmares, where the person is actually re-experiencing what happened at the time and usually stops being reactive or responsive because they are back in the situation, in the traumatic situation. There is also an absolute hypervigilance to certain triggers like sound, smell, etc., which is quite clear in post-traumatic stress disorder. Now, in emotionally unstable personality disorder, people don't tend to re-experience trauma. So there is no flashbacks. Usually there is no flashbacks and there is no nightmares relating to the trauma. The difficulty here for a psychiatrist is that people who developed emotionally unstable personality disorder very often are also experiencing symptoms of post-traumatic stress disorder. And I'll explain it more when I get to the point how people develop emotionally unstable personalities. Another two conditions that need to be distinguished from emotionally unstable personality disorder is histrionic and narcissistic personality disorder. As we know, they sort of are in exactly the same cluster of personality disorders. So it's cluster B, where the presentation can be very dramatic. However, neither of the conditions, neither histrionic or narcissistic personality disorder, is characterized by this profound fear of being abandoned, of being not likable, of being not lovable. And there is no identity disturbance. So the person knows who they are, can define who they are. And then we have schizoaffective and psychotic disorders, which are slightly different. So a person suffering from EUPD can present with transient psychotic symptoms in the form of sometimes auditory hallucinations, but they are usually always stress-induced and very brief, where psychotic disorders and schizoaffective disorder are the main feature is that the psychotic symptoms are persistent, so they are not related to stress. And there is a persistent delusional beliefs within this disorder. So beliefs which are not substantiated by truth, where they do not exist in emotionally unstable personality disorder. So before I go into psychotherapeutic interventions, the question is how people do develop emotionally unstable personality disorder. And it's not a condition that one is born with. It is all developed following abusive upbringing in certain ways. Abusive. So people who are subject to emotional neglect and physical or sexual abuse, mostly long-term abuse, are likely to develop the emotionally unstable personality disorder. As I said before, because of the abuse, they also can present with comorbid post-traumatic stress disorder. However, the emotional roller coaster is characteristic to EUPD rather than post-traumatic stress disorder. In terms of interventions and treatment, to look and think about treatment of personality disorders as such, we need to consider that actually personality is a set of beliefs about self, about others, and about the world, which to a certain extent is biased due to what happened to the person in early stages of development. And therefore, as it is a set of beliefs, evidence-based approach, therapeutic approach to emotionally unstable personality disorder is mainly psychotherapy. Within the psychotherapy, the first line of treatment is what we call dialectical behavioral therapy, which is structured and mostly skill-based therapy, which is focusing on things like mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness. DBT actually teaches the person alternative techniques in terms of interpersonal effectiveness and tolerance of distress, alternative to self-injurious or self-destructive behaviors. Then we have mentalization-based therapy, which aims to improve patients' ability to understand their own or others' mental states to reduce emotional dysregulation. Unfortunately, people with emotionally unstable personality disorder, due to the extreme emotional reactions that they present with, are very often failing to recognize others' mental states and others' emotional responses, which then very often leads to the crisis. So this ability to recognize someone else's mental state is crucial in treatment of emotionally unstable personality disorder. There is also transference-focused psychotherapy, which utilizes therapist-patient relationship to explore unconscious patterns and restructure internal object relations. And the last one and the most important one is schema therapy, which combines elements from cognitive behavioral therapy, attachment theory, and psychodynamic approaches to change deep-seated maladaptive schemas. Why it is important and why the psychotherapy is so important in treatment of emotionally unstable personality disorder. Excuse me. As I said, because personality is a set of beliefs which then causes emotional responses, the only way to change this set of beliefs about self, others, and the world is to review and find alternative views on those beliefs and restructure those beliefs. This leads me to pharmacological management and medication strategies. So actually there is no approved medication for emotionally unstable personality disorder. And what as psychiatrists, we target symptoms or clusters of symptoms rather than disorder as such. And the reason why is there is no medication, there is no chemical that can change someone's beliefs. That can happen only in psychotherapy. However, at the initial stages of treatment of emotionally unstable personality disorder, we can use antidepressants, which alleviate mood symptoms, anxiety, but evidence is limited. As we said, we use sometimes mood stabilizers, which can reduce impulsivity and the emotional reactions, and antipsychotic medication, which manage the transient psychotic episodes, aggression, dissociation, or impulsivity. Now, the prognosis and long-term management. So to talk about prognosis and long-term management, we need to take into consideration where actually a person's personality is established, is fully established. And there are various research papers, but the general consensus is that that happens around the age of 25, and maybe slightly later for male. And as that happen, what we see is that personality disorder can have a natural cause. So symptoms, certain symptoms often remit with age. And things like impulsivity and emotional or affective instability tend to decrease over time. The functional recovery, unfortunately, despite symptom improvement, interpersonal and vocational impairments may persist, and they usually require therapeutic interventions to change, so they don't really subside with age. The relapse prevention requires sort of sustained therapeutic engagement and personalized plans and crisis contingency protocols. But what is the most important? What are the positive prognostic indicators? So early intervention. So if someone starts presenting with symptoms or potential symptoms of emotionally unstable personality disorder, sooner they start treatment, better. As we said, the personality fully develops around the age of 25. So if the therapeutic interventions are before the age of 25, around the age of 25, personality can still be sort of moderated, can still be changed. It's slightly more difficult after the age of 25, but it doesn't mean that it is not possible. It is also very important if the person with emotionally unstable personality disorder is able to establish a strong therapeutic alliance with the therapist, which can be supported, and the positive prognostic indicator is a stable social support that they have. So just concluding my talk about emotionally unstable personality disorder, what is the future directions in psychiatry? So definitely it is an integrated approach. So combining psychotherapy, pharmacotherapy, and community support is going to have the best outcomes. Also, what I already said, early detection and tailored interventions to improve prognosis. There is also a definite need for an ongoing research, and the future work is needed to refine therapies, understand neurobiological underpinnings, and develop some biomarkers for that. And the also important advocacy and policy. So it is very important that we look at the stigma reduction. Very often, people with emotionally unstable personality disorder are perceived as dramatic, are perceived as attention seeking, which is untrue. It's absolutely untrue. It is not their choice, those behaviors that they present with, and the emotional dysregulation is not something that they can control and put on. So definitely stigma reduction is very important. Also, the healthcare access is very limited at this moment in time for people suffering from emotionally unstable personality disorder. They are almost treated as a bit of bed blockers and time wasters, mostly when they sort of present in A&Es with repeated suicidal attempts. And it all goes into training and understanding about healthcare professionals, the nature of the disorder. It is not their fault that they are suffering from this emotional dysregulation. It's actually the fault of the world they were brought up in. And unfortunately, this understanding is very often lacking amongst medical professionals, mostly non-psychiatrists, and is leading to increased distress and stigma that is associated with emotionally unstable personality disorder. That is the end of my presentation regarding emotionally unstable personality disorder. I hope you found it interesting and I hope you found it informative. If yes, please subscribe to my channel, and I'm Psychiatry. And if you have any questions, comments, please put it under the video. Thank you, and I'm looking forward to seeing you at my next video.